In the last 24 hours, the country reported a little over 44,000 COVID cases, out of which over 22,000 or 50% have come from just one state, Kerala. You would have heard this state's name in the headlines and the spotlight a lot. Now, the government has come out with its own side, saying that this is a campaign against one state. There are different data sets which can be interpreted differently as well. What is its defense? Let me cut straight across to Veena George, Minister for Health and Family Welfare of Kerala. Ms. George, thank you very much for speaking to us. Do you think that it was a mistake to have given the relaxations, especially now that it is being suggested that the sudden surge is because of the relaxations that were given? You were hailed for the Kerala model, but now you are giving over 50% cases to the national tally. What has gone wrong in this much spoken about Kerala model?
This was a case, the same was the case in the first wave too, because during January 2021, the state contributed to almost 50% of the total cases. So even our strategy was always, or is always, to delay the peak, to drag the wave. So when this first wave, during the time of the first wave in January 2021, from Kerala, the cases was like that, the state contributed to almost 50% of the total cases. So now, the second phase started in Kerala by the middle of April. We had our peak on May 12th, and on May 12th we had more than 43,500 cases. And then the number went on decreasing, and we are now on a plateau. And our strategy was always to keep the number of positive cases below the medical capacity threshold. So you know that there is not a single case in Kerala where the patient died without getting oxygen or without getting a medical support, without getting a hospital bed or an ICU facility. So we have always tried, and we are trying to keep the number of cases below our capacity, our medical capacity threshold. So, and we have proved that we are successful because the seroprevalence study shows that. The study conducted by the ICMR shows that more than 50% of the total population is still unaffected. Only 42.7% of the population have antibodies in their body, and it can be either through infection or through vaccination.
You know, Kerala has repeatedly, and a lot of experts have also repeatedly now quoted the sero survey. But if seropositivity makes Kerala a better performer, what do you say about Assam, for example, which has the second lowest seropositivity, but cases are almost 1/10 of Kerala?
See, in Kerala, our strategy is always we have tried to identify every single case. The tests we are doing per million, it's the highest in the country. Yesterday we did 1,63,000 tests. Day before yesterday we did more than 1,93,000 tests. So we want to identify every single case, and we trace out all the primary, secondary and tertiary contacts, and we do testing, tracing and treating the test is very high. The test per million is very high, and also one of the most important thing is that the Delta variant is causing spreading the infection in this second phase, and the infectability of the Delta variant is very high. You know that. So also the density of population in Kerala is very high. That's why the first COVID case in India was reported in Kerala during January 2020, and from there we moved on. We have evolved a strategy. We have developed a system of testing, tracing and treating the positive cases, and also allowing the people to go on quarantine. And then the first wave, and we talked about the first wave, and the first wave was there in the state till February, March, and on January we had the maximum number of cases. And at that time, in the other parts of the country, the number of cases were very less compared to the cases in Kerala. So we always try to delay the peak and drag the wave. And during the second wave started by the middle of April, and then on May, by the middle of May we had the peak. Then the cases got reduced, but now we are moving on a plateau. This is quite expected in this phase of the wave. Yeah.
But madam, One, also when you talk about density, then Assam has as much density, in fact has greater population density than Kerala does. Second, we're seeing the number of cases rising, not really plateauing. Anyhow, if you're talking about seroprevalence data, it also shows a large part of your population, which is around 60%, is still vulnerable. Then why did you make relaxations both for the Sabrimala visitors as well as in the days leading up to Eid? It means that you made 60% of your population vulnerable to infection. How can then that move be prudent?
We didn't give relaxation for Eid. Actually, the shopkeepers, the traders, and all our people were asking for some relaxation because the state was going through lockdowns, through restrictions, and we have categorized the LSDTs according to their TPR, test positivity rate. So below 5% there are no restrictions, from 5 to 10 there are some restrictions, from 10 to 15 there are more restrictions, and above 15 it's like almost like a triple lockdown. So we are following the method, and we have given some relaxation during those 3 days, but even then the TPR was around 10, 11, 12%, and now it's almost the same, 12, 13, 11%. Why the TPR is high? It's because, yes, the tests, we are doing maximum number of tests, and we are doing targeted tests.
Ma'am, if you're talking
we are doing targeted tests, yeah.
Ma'am, if you're talking about the traders' request, then the traders have also requested for the weekend lockdown to be removed. Why are you not acceding to that request?
See, we had the weekend lockdown from quite a long time, because Saturday, Sunday we had the we have weekend lockdowns, and because in Kerala all the people wear masks and we observe social distancing, and the people are not allowed to gather beyond the number 20 during marriages, during funerals, or during public gatherings or anything. So we always sanitize, we use sanitizers and all. So the people are cooperating with all the measures adopted by the government, and the Delta variant, the virologists, the experts now say that it spreads like chicken pox. It spreads like anything. So it's a Delta variant that's causing the infection in this second wave in Kerala, and the infectivity is very high, and the density of population in Kerala is very high, but still we are moving ahead, and we have proved that we could protect our people. More than 50% of the people is still vulnerable or susceptible. It shows that our protective measures were good enough to protect them. So the only way before us is to vaccinate our people, to vaccinate the people within the maximum people within the minimum time. And we have achieved, like, 2 of our districts, Wayanad and Kasaragod, they have already vaccinated 100% people above the age group of 45, that's above 45, and the state average of first dose vaccine above the age of 45 is around 80%, 79-80%. So we have already started vaccinating as per the policy of the central government. We have started vaccinating people above 18, and we have even before that the state has tried to procure to buy vaccines, and we have given priority. We have decided priorities like people with comorbidities, with NRIs, students who are traveling abroad, moving out of the country, out of the state, etc. So we have given priorities, and we have started vaccinating them. And after the new policy, after the central government has decided to adopt the new policy, we are giving vaccines to everyone above the age of 18. And with the vaccination pace, we are moving on very fast, and our aim is to vaccinate maximum number of people within a minimum time. Yes.
So if you think that you've got most of the situation under control, why did the center have to intervene?
We are welcoming them, because a couple of weeks ago we had another central team visiting Kerala here, and they visited many districts, many hospitals, and they had interactions with our people, and they saw all the public social life in Kerala. And I had an interaction with them after before they leave Kerala, and they told us that they are quite satisfied with the way the state is dealing with the situation. They have no worries about the TPR, because it's quite expected. They said that it's quite expected. It shows that our protective system or our defensive mechanism is really good. So they are satisfied with the they have no worries about the TPR. And also the people are really, they are aware of the situation. We are asking, and the state government is closely monitoring the situation. And as I told you, we have categorized the LSDDs according to the test positivity rate, and it goes like a cycle. Those LSDDs above a 15 group, so they will naturally have a tendency to reduce the TPR, and they will do maximum tests. They will be keeping the people, all the people will be in their houses. They will shutting down all the shops, and what happens is that they will be coming to a group, that the first group below 5%.
Okay.
So it shows, which shows that the system we have evolved is working good.
But you know, one fact is indisputable, which is that you have the maximum number of cases in the country as of today. It has constantly risen. In fact, you are contributing to over half the positive cases we have in India as of today. Why then would you call people discussing these numbers and expressing alarm as a conspiracy against your state?
It's quite unfortunate, because when you analyze the seroprevalence study conducted by ICMR, when you look at the death rate in Kerala, the COVID death rate in Kerala, it's one of the lowest in the country. We are doing excess death analysis also. Even if there are some deaths which have gone underreported or which are left out without having some documents or medical bulletin or anything, we are taking all those, we are trying to include all those deaths in the list, and we are doing excess death analysis. And even then, the death rate or the fatality rate of the state will be the lowest in the country, is one of the lowest in the world. So the seroprevalence study, the data of seroprevalence study or the death rate and etc. shows that also the occupancy in the hospitals, that's a very important thing. The occupancy of hospital beds, the ICU beds is it's much lower in Kerala, because which shows that the severity of the diseases is very less. So all these factors shows that the situation is totally under control. But we do welcome the central team. Let them visit our districts, our hospitals, and it's quite unfortunate that there is a political color in this campaign, and I don't have anything to, yeah.
Okay, you're talking about a political color, etc., but now you have neighboring states as well. For example, Karnataka today, you have Basavaraj Bommai saying that 3 districts which are bordering your state in Karnataka, there's a spurt in cases there as well. Surely those numbers also cannot be a campaign.
We are doing tests at the borders also. So when you compare the rate of reporting the positive cases in Kerala, we report every 1 case in the total 6 cases, which is one of the best figures. And also, when you read the fatality rate of the state, when you read the seroprevalence study data of ICMR, you can see that there is nothing to worry about Kerala, and we will definitely will be the number of cases will be getting reduced these days.
Okay, so the Supreme Court, by the way, had said that if there are any consequences of the relaxations that you have given, the people responsible will have to face the music. Now that the matter is back in court, the same petitioner has gone back to the Supreme Court. Data shows there has indeed been a surge in numbers, even though you are saying it's not linked. How are you going to defend yourself?
So, see, the Honorable Supreme Court is, if the court analyzes the situation, the state is open to the decisions of, we are expected to obey the decisions of the court, Honorable Court. Thank you.
Okay, all right. I think I will have to let you go at this point. Thank you very much, ma'am, for having joined us on the Newshour Agenda. We'll in fact be keeping a close eye on the numbers from Kerala as well, also the Sero survey numbers and what the central team has to say about the factors behind this surge of COVID cases in Kerala. Thanks very much for having joined us. Stay safe. I will see you after the weekend.